Art therapy, as defined by the American Art Therapy Association, is an integrative mental health and human services resource that works to enrich the lives of individuals through active art making, creative process, applied psychological theory, and human experience within a psychotherapeutic relationship. By this definition, art therapy is essentially the practice of using artistic process alongside a therapist with the goal of positively impacting a patient's life and mental health. If you think that this sounds like a relatively new advancement in the field of psychology, you'd be correct. Though art has been an innate part of human life and culture for thousands of years, the idea to use its creative and mental process in a more clinical setting wasn't introduced until the 1940s. Mainly used for war veterans experiencing PTSD, and wasn't completely integrated into society until decades later. Two major voices in America that propelled this idea in its early years were educator Margaret Naumburg and artist Edith Kramer. They both are coined to be the mothers of art therapy for their contributions to the foundations of the practice, with Naumburg being credited for linking art to unconscious expression, and Kramer for being a founding figure in outlining art therapy education. With this definition and a short history laid out, there are still a few questions to be answered, like, what is art therapy? Who does it benefit? How does it work? And how can one go about getting involved in it? Clinical art therapy is pretty simple at base level, as it is just classified as an individual working alongside a guiding therapist to use art as a medium of communication or outlining of their own emotions that they may struggle to outwardly articulate and express. However, anyone can use the artistic process as a therapeutic exercise, regardless of if they have access to a specialized art therapist or not, though there are extreme benefits to having a certified and educated professional help tailor sessions towards an individual situation. When we talk about results and benefits, it is important that the psychology and neuroscience behind art therapy is discussed. The truth is, at this point in time, the scientific logistics are still being researched by professionals, meaning that there is no true definitive data that proves its efficiency, though there are many case studies and personal growth stories that serve as subjective proof. This lack of conclusive data is the leading criticism of the practice, as many take it as an excuse to dismiss the ideas and other evidence entirely. However, professionals have explained that the difficulties they've faced are due to the complexity of the effects of art therapy, which uses multiple parts of the brain, causing confusion when trying to pinpoint which factors influence which variables. However, the simple idea is that the artistic process allows individuals to access a part of their unconscious mind where emotions and thoughts lie, which they can then harvest upon and subconsciously integrate into their physical artwork through metaphors and connotative symbols that they and their therapist can study to try to ease the struggles that they face. As far as approaches go, Rob Gray from the Center for Educational and Clinical Art Therapy describes there to be two main distinct ones, which he coins art in therapy and art as therapy, respectively. The art as therapy approach revolves around using the process of art as the actual therapeutic process. It is based more so on how the expression of art heals the individual rather than their interpretation of the content. In a session, this would be seen as a patient and a therapist working on an art piece, whether it be painting, sculpting, drawing, and allowing the artistic process to awaken or aid the patient with their inner emotion or struggles. The art in therapy approach, which is notably more common, is usually paired alongside verbal communication with the therapist in order to interpret images or metaphors in a personal art piece. This is more content-based rather than process-based, and would be pictured as an individual interpreting a piece of art, their own or another's, and a therapist guiding alongside them to decipher what their interpretations mean. This gives patients a perspective of their internal thoughts that they may have not been able to access beforehand, and allows them to focus on that when working towards bettering their mental health. With this being said, art therapy is nearly always catered to fit the patient's specific situation and needs, and on top of the two main general approaches, different art mediums are also used to provoke different effects. Juliet King, an art therapy educator at George Washington University, described this, saying that less restrictive media like watercolor or clay tap into more emotional centers of the brain, while more resistive media, pencils, rulers, building something 3D, utilize more cognitive processes. Specifically, looking at watercolor and mask making, both hold a specific unique approach that can be utilized to best fit a patient situation. Watercolor is difficult to control, so King noted that it is extremely useful in cases where individuals have difficulty accessing their emotions, as the process will force them to relinquish control over their mind and allow the unconscious thoughts to bleed onto the paper. Papier-mâché mask making is also a common exercise, usually used with people suffering from PTSD, in which they are tasked with making a mask that will stare back at them. This often produces a product that commemorates their view of themselves or their trauma, which can provide a sense of healing or a ground understanding for the therapist to base their sessions on to maximize effectivity. There are many more exercises and art styles used, such as art journaling, sketching, making collages, sculpting, finger painting, carving, doodling, dream drawing, and coloring mandalas, just to name a few. These all have unique responses and can target different conditions or situations to benefit patients. Speaking of patients, the question still stands of who does art therapy benefit? The truthful answer is everyone. Specifically, art therapy has been shown to be helpful in cases with individuals suffering from PTSD, addiction, anxiety, attention disorders, grief, depression, eating disorders, physical illness, trauma, stress, and many more conditions. Whether you suffer from one of these, or are just experiencing occasional stress, the process of art therapy has proven to be very useful in providing some comfort and relief. As an example of someone benefiting from art therapy, art therapist Sylvana Riggins shared her 5-year-old daughter's story. After coming home from a bad day at school, she was distraught, and Riggins prompted her to draw her experience with pastels. She came up with an image of lightning and darkness. The lightning symbolized her mistakes in school, which weighed down upon her and caused clouds of rain and sadness to pour. She also painted herself in the middle as a large black butterfly that she viewed as bad, which is how she felt about herself. Doing this exercise allowed Riggins to identify the issues and thoughts that her daughter experienced, such as the idea that making mistakes equated to being a bad person, and she was able to quickly combat them and work towards alleviating the pain. Another example, shared by Juliet King, who was mentioned earlier, was the story of John, a Vietnam War veteran who suffered from PTSD and turned to art therapy in search of some relief for his mental health. John struggled at first with trying to retain some control as he was tasked with watercoloring, but after he realized that it was pointless, he stopped thinking about it and let his emotions take over. He created art pieces, such as images of his heart without arteries, because he, as King recalled, said, "My heart doesn't have them, I'm completely disconnected." After a few more sessions, King saw great improvement in his condition, stating that he learned how to use less paint and to create something that had specific form. For a person grappling with avoidance and numbing nightmares, symptoms that go along with post-traumatic stress, to be able to control something at your own volition in an easy, calm, supportive way is huge. While there may not be decisive scientific proof of art therapy's effectiveness, both of these examples serve as two of the countless stories of individuals who have benefited from the practice. Using art as a form of expression, self-discovery, and healing is incredibly powerful and can be of use to anyone, whether you're experiencing stress in school, going through a breakup, or suffering from a serious condition like John. The intricate process of making art combined with the guiding nature of a psychotherapeutic relationship can provide a deeper understanding of yourself as a person and positively impact your mental health. If you want to get involved with art therapy, you can locate the nearest place that offers its practice on the American Art Therapy Association's website, and I'll provide links to a few additional resources, such as the Art Therapy Project, that offers free art therapy and holds showcases in which patients' artwork can be viewed, as well as a link to a counseling therapist Shelley Clammer's list of art therapy exercises people can practice at home if they don't have access to therapy. The American Art Therapy Association also provides many COVID-19 friendly resources on their website to aid individuals during this time. If this sounds like a process that may be of use to you personally, don't be afraid to reach out and get the help that you need. Remind yourself you are worth it, and things will get better.